For vitamin D, this could be the most important vitamin that we're going to talk about in this class because it's the most prevalent deficiency in vitamins that we have in the United States, as far as I understand. 95% of the United States population, per the NHANES study, which is discussed in the introduction course for $69.99. It's a really, really good course for 5 CEUs, you guys. It goes over all the comprehensive blood panels, brief intro to the epigenome, intro to nutrition, supplementation, peptide therapy. Really, really good class. We go over the study in that class, but per the NHANES study, 95% of the US population is deficient in vitamin D, right? So that means that 95% of the US population cannot possibly be optimally healthy, because it's impossible to be optimally healthy without optimal vitamin D levels, because vitamin D, just like magnesium, is involved in so many different processes in our body. Vitamin D acts as a vitamin, it acts as a hormone, it acts as a steroid, it acts as all sorts of different things. And if we don't have sufficient vitamin D, we cannot have proper immune function, we can't have proper health, right? So just like with magnesium, the RDA and the tolerable upper intake level are absolute crap. It's basically medical malpractice and medical negligence what the FDA and the USDA tells people to do, because based off of what they say, 79% of the United States population is now fat, overweight, or obese, right? And I'm not saying that it's the government's fault that people are fat, but it's their fault that people are so unhealthy in general, because the recommendations that have been coming from the trusted public health experts for the last 50 years have basically been the opposite of what you should do to be healthy, right? That's the unfortunate truth of the situation. If you're confused about that, just look at the last 5 years of evidence, right? Every single thing, basically 100% of the things the FDA, the NIH, and the CDC have done or told us, the general public, to do in the last 5 years have not only been wrong, they have been the inverse of the truth, or like the negative derivative of the truth, right? It's the actual opposite of what you should do to be healthy, right? So unfortunately, nowadays, honestly, and I do honestly believe this is more true than not, if you want to be healthy, do the opposite of what the government is telling you to do, more or less, right? They've told people to eat a ton of grains and that sugar is not bad for you for the last 50 years. Horrible, right? They've said that high-fat diets are bad for people. Totally wrong, right? So everything that they've told us to do is wrong. Don't go outside when there's COVID. Well, what is the second leading indicator for serious adverse events with COVID? The number one risk factor was obesity. Obesity decreases your ability to produce vitamin D. The number 2 risk factor was vitamin D insufficiency. So vitamin D insufficiency, you guys, was the number 2 leading cause or leading indicator that people were going to have a serious adverse problem or have to go to the hospital with COVID. So did anybody talk about vitamin D throughout the pandemic? No. What did they tell you to do? Go inside and don't get sun and lock yourself away and don't expose yourself to germs, so that now that we have all these lovely things like sudden death syndrome with young people, right? A huge amount of these things could have been avoided if we had just told people to properly supplement and get enough vitamins and minerals in your body, right? It's the same thing that we've known how to do for all of human history with people being sick. And apparently in 2024 we forgot how to do, or in 2020 we forgot how to do it, right? So really, really frustrating. But anyways, 95% of the US population is deficient in vitamin D, right? So the tolerable upper intake is, according to the government, is less than everybody should be taking, right? So again, this is what I take. This is the information that I believe to be the most accurate from all of the hundreds of pages of literature and podcasts that I've listened to, and just lots and lots of research, and from just personal experimentation with myself and with my patients and stuff like that. Most people need to take somewhere around 5,000 to 10,000 IUs of vitamin D a day, right? So the tolerable upper intake level of 4,000 is completely false, total crap, right? As far as toxicity goes, The only studies that I find in the literature talking about vitamin D toxicity where your liver and your kidneys start to dysfunction a little bit, and again, it's not like you're going to die, which is a side effect of ibuprofen. So death is listed as a side effect of ibuprofen 3 times. Same thing, it's listed in Tylenol and all these drugs, right? Not a possible side effect of vitamin D toxicity. And the only times that I've read about vitamin D being toxic is when people are taking like 60 to 100,000 IUs a day, right? So Angela, who works for me, my CFO, she told me the other day that one of her patients did actually have vitamin D toxicity, but it was because the patient misread the bottle of vitamin D. So their doctor had given them, I believe they were 50,000 IU pills that were supposed to be taken once a week, which is definitely not a good way to do it, right? Just not a natural way for our body to get vitamin D. It's much better to take smaller portions of vitamin D on a more consistent basis, because the way that our body works, we can only maximally process so much material each day, right? So we really can't process too much over 20,000 IUs of vitamin D a day, as far as I understand, and the rest of it gets deconverted and excreted, right? So in the summertime, even though I'm outside all the time, I take 5,000 IUs of vitamin D a day in the summer, and I take 10,000 IUs of vitamin D a day in the wintertime, right? So the tolerable upper intake level, total crap, don't pay attention to that. Everybody should be taking about 5 to 10,000 IUs a day, as far as I understand, right? Again, I take 5,000 a day in the summer, 10,000 in the winter, just because there's less sunlight in the winter, right? So I'm in Nebraska right now. We can only get vitamin D through the sun in Nebraska for about half the year. So for about 6 months out of the year at least, we can't get vitamin D through the sun because there's too much atmosphere that the sun's going through. The UVB radiation doesn't get through to the skin, we're not able to convert vitamin D, right? In places like Alaska, you can only get vitamin D for like a couple months out of the year. So every single person should be taking vitamin D, because 95% of the United States population is deficient in vitamin D, right? And then the RDA is medically negligent. Like, the people that believe this to be the truth are so far gone as far as understanding medicine. It's hard to comprehend, right? So 0 human beings in today's society, where people are never outside anymore, right? 600 IUs a day of vitamin D is not sufficient for any human being in 2024, more or less, in the United States, right? So cold and flu season, we'll get to this in a second, but cold and flu season really should be thought of as vitamin D deficiency season, right? It has nothing to do with the temperature or anything like that. It has to do with the amount of sun that's getting through the atmosphere, right? And getting to your skin. In the wintertime, people can't get vitamin D through their skin, and a big percentage of the United States. In the southern states you can, like Texas and Alabama and stuff, but not up in the northern latitudes, right? So 400 to 600 IUs a day, which is the RDA, is absolutely medically negligent. 0 human beings in 2024 can be healthy with that, more or less, because people just aren't outside enough anymore, right? Foods that are high in vitamin D, you guys. So sockeye salmon, all salmon are good foods, really. Fatty fish, mushrooms are a relatively decent source of vitamin D, and fatty fish. Eggs are not too bad, right? But again, if you look at the amount of vitamin D in food, right? So 3 ounces of rainbow trout, which I love, is only 645 IUs a day, right? So most people do not get nearly enough vitamin D just from the food that they eat, right? So you need to supplement with either sunlight and or supplementation. And I like to have my vitamin D levels at about 75 to 85 nanograms per milliliter, right? So the recommended blood level per standard medical practice in the United States is 30 to 50 nanograms per milliliter. So just think about that for a second. Just look at those numbers. So you're telling me that I could have 30 nanograms per milliliter of vitamin D and be considered normal, and I could also have 50 nanograms per milliliter of vitamin D and be considered normal. So if you go into a doctor and your levels are anywhere between 30 and 50, they just say you're fine, which is absolutely wrong. It's totally 100% wrong, right? All human beings should want over 50 nanograms per milliliter of vitamin D, and this is clearly shown in the medical literature. right? So again, remember you guys, the RDA, and we go over all this stuff in the introduction class, the intro, the 69.99 class. It's a really, really good class. The introduction class, we go over exactly what the RDA is, but just again, for brief reference, the RDA is the minimum amount that people need to not be sick, right? So the RDA is not based off of health. It's not based off of you being optimally healthy. It's based off of you not being sick. And that's what the pharmaceutical companies and the government want. The more sick people they have, the more money they make. Our medical system, it's just a secondary factor of humanity, I guess, just the human conditions, that people are greedy, and that our medical system is based 100% off of very few small group of people making a ton of money based off of the rest of the population of the United States being sick. That is how that's how it works, right? So the typical blood level is 30 to 50. Nobody should want their blood levels at 30 to 50. There's been a lot of studies showing that over 40 has significant benefits, and then there's a ton of studies showing that you get the real anti-cancer and antiviral benefits, and you really get the maximum vitamin D benefits if your levels are somewhere around 70 nanograms per milliliter. Again, I like mine between 75 and 85. Again, it's going to be different for every individual person, but that's what I like, right? So again, we talked about the RDA, way too low, 600, 800, or 400, 800, or whatever it is I use a day. Totally way too low, like 5 to 10 times too low, right? This is one of the reasons that so many people are unhealthy in the United States. And being overweight inhibits your ability to produce vitamin D from the sun. So those people really, really need to take vitamin D supplementation, right? The Endocrine Society is a little bit better recommendation. They recommend 1,500 to 2,000 IUs a day. Again, their goal is 38 to 50, the goal is to get to 30 to 50 nanograms per milliliter. That is not enough to get there, right? So on the next page, there's a study, but it says that in general, if you want your vitamin D levels to be above 40, you need to take at least 5,000 IUs a day. So again, I think you want your vitamin D levels to be around 75 or 85. So that's why I take 5,000 in the summer, 10,000 in the winter, and I get sunlight, and I get it from my food, right? So that's what I take. As far as the way that vitamin D gets absorbed or the way that photons get absorbed in the skin and get produced into vitamin D, and we'll go over this a couple times, right? But the sun hits the skin, you get 7-dehydrocholesterol, absorbs ultraviolet B radiation, right? UVB radiation, 290 to 320 nanometers, right? This breaks the bond between the carbon atoms that produces pre-vitamin D. Pre-vitamin D is unstable, right? So the unstable pre-vitamin D, and some people consider it a vitamin, a hormone, a steroid. It undergoes a rearrangement and it forms a stable form of vitamin D. That form of vitamin D is transported to the liver and it's converted into 25-hydroxy vitamin D. That's one of the bioavailable or bioactive forms, right? So most things in our body need to get converted either once or numerous times into the bioavailable form of vitamin D. So that's why the Thorne supplements that I take and all the supplements I take are methylated supplements, you guys. So the body doesn't have to break it down. What we're putting into the body with methylated vitamins or the vitamin form that's immediately bioavailable or bioactive or usable in our body, so it doesn't require any extra energy or any extra ATPs to break down and to convert into the usable form. So the major problem that the vast majority of people have is that they're living with chronic energy deficiency because they're living in a state of chronic sympathetic hyperactivity. We get chronic tissue hypoxia. The mitochondria start producing 18 times less ATP per molecule of glucose processed in the absence of oxygen, right? Very, very detrimental. And then the 25-hydroxy vitamin D, that goes to the kidneys and that gets converted into the most bioavailable form, which is 1,25-hydroxy vitamin D or calcitriol, right? So there's two typically talked about bioavailable form, 25-hydroxy vitamin D and 1,25-dihydroxy vitamin D.